A very good day, everyone, and we are reaching out virtually to all of you in this current time. Certainly not ideal, given the quality, the seniority, and the experience of the panelists that I have today with me. Let me first start with introductions, and then probably we'll get to this very, very relevant topic. Every healthcare provider, every patient, and every healthcare technology and digital company has been talking about, which is really how telehealth, remote medicine, remote teleradiology, everything with respect to how technology has been playing a role in changing the way healthcare stakeholders have been interacting with each other. So, dear all, my name is Amit Mookim, based in Mumbai, and currently I'm the general manager of a company we call IQVIA. We are a global healthcare research, information, and healthcare analytics organization. We believe in the power of human data science and work closely with life sciences companies, payers, providers, governments across the world to bring in insights, both clinical and non-clinical, into the forefront of healthcare. It's a pleasure to be here with all of you. And I would now hand over to my esteemed fellow panelists to introduce themselves. So, Dr. Sujit, maybe we could start with you, sir.
Sure. Thank you very much. I'm privileged to be here amongst all my colleagues who are extremely well informed on these matters. I represent the Dr. Ali Shirindani Hospital at Y in Mumbai, and we are a dedicated COVID hospital. And today we are in the midst of a pandemic, and we've got the second wave hitting us. So the concept of telemedicine, teleradiology, and so forth, and so on and so forth, is extremely relevant for things for today. So therefore, with this brief, I shall request you to introduce the other panelists. I've introduced myself. Thank you.
Thank you so much, Dr. Sujit, and really appreciate you taking your time to be here. Over to Dr. Santosh.
Yeah, good morning, everyone, and thanks, Amit and Voice of Healthcare, for having me as part of this panel. So I'm Dr. Santosh Shetty. I'm the Executive Director and CEO at Kannan Ambani Hospital. And basically, I'm a doctor by training, but hospital operations is my passion. For the last 22 years, been part of running hospitals. And the last year and a half truly has been for all of us amongst the most challenging times in healthcare. And as Sujit rightly mentioned, I mean, these COVID times have truly brought our management skills to the focus and helped us to cope up with some of the most difficult challenges that we've ever seen. And telemedicine, teleradiology, and digital health truly is something that is here for the years to come. And this pandemic has only accelerated the adoption of that. And I look forward to interacting with all of my colleagues as part of this panel. Thank you.
Thank you so much, Dr. Santosh. Over to you, Satish.
Yeah, hi. Good morning, everybody. Thank you, Amit, for inviting us. Thank you, Voice of Healthcare, for inviting MediBuddy. So a quick background about me is I did my engineering. I'm actually an engineer. I graduated from IIT Madras. After IIT, went and worked with Philips Healthcare. So my introduction to healthcare happened at Philips. I was in the design of cath lab machines. I was based out of Pune initially. And then we had a plant in Chakan, so that's how I met a lot of hospitals. All of the hospitals that we have here, I personally met all of them, and the doctors at the cardiologists at all of these hospitals like 5-7 years ago. So that's also my introduction to healthcare, and spent a lot of time with doctors, hospitals, patients, operation theaters. And after that, left Philips to start a digital healthcare platform that makes sure that enables high quality healthcare and ensures that that's accessible to people across the country. So today, MediBuddy is a end-to-end digital healthcare platform. Patients can come do a video consultation with a doctor, also book appointments and go to the hospital, but also get their medicines delivered to your home, get your lab test done, and all the way you can actually get admitted in a hospital, and that's called IPD. So all the way from a doctor consultation on video till getting admissions. And we are very happy that we've been able to help more than 35,000 patients daily now. So on a daily basis, people across the length and breadth of the country come and use MediBuddy to access good quality healthcare. And pandemic has sort of accelerated the digital adoption. And in a way, it's very, very critical for India, because in order to get both of them right, both the accessibility right and the affordability right, there has to be a right mix of both digital as well as offline assets. And happy to be on the panel, please.
Couldn't agree with you more. And Satish, I've known Satish for quite a few years. Satish, it's been a fantastic journey what you've built. Congratulations to you, and thank you for coming onto this panel, because I think we've got 4 top hospital leaders, and then we have you as an entrepreneur who will do the reality check for all of us. So thank you for being here. Over to you, Dr. Pat.
Thank you, Amit, and good morning, everybody. I am a radiologist by profession, so I have about 33 years of experience in radiology, including television. I am also the director of medical services at Nanavati Super Specialty Hospital, which is a 450-bedded hospital. I have been working as a leader in medical administrative functions and clinical team expansion at Nanavati Hospital for the last 6 years. Last year has been very, very challenging for us. We treated about 5,000 patients with about 1,000 plus in ICUs, and we tried to adapt digital technology very, very quickly in terms of telemedicine, teleradiology, and sort of turning around with the wave dying down. And again, we are trying to turn around with wave coming up, quick moving from physical to digital, digital to hybrid. And I have been leading that function, of course, with my team of about 7 or 8 people. Thank you.
Thank you, Dr. Parker. And last but not least, over to you, Dr. Tarang.
Good morning, everyone. Thanks, Amit, and thanks to Voice of Healthcare for giving me the opportunity to be here with all of you. So I think everybody has already touched upon, COVID has indeed changed the fabric of life for everybody. And I think that it's but I think at the same time, it helped as an accelerator to move the digital health and move telemedicine ahead. What would have been achieved in the next 5 to 10 years, I think quite a few of in certain areas we have achieved it in less than a year today. I'm Dr. Tarang. I am the CEO of Sir H.M. Reliance Foundation Hospital. And our hospital, apart from being providing care to all our inpatients, also caters to not many patients on outpatient basis in a very non-typical manner, the way normally other hospital services are aligned. COVID has been a tough year, because we had 2 facilities. One was completely non-COVID and one was COVID. So I can, from the experience of both, just share that it's much easier to manage a COVID facility than to keep a hospital completely non-COVID. It really needs lots of testing, lots of compliance to PPEs, and there are a lot of SOPs which go into it. And I think at this point of time, the digital piece and the remote management really helped us a lot. With our small facility of 100 beds at Seven Hills and a few beds at RFH, we have been managed to take care of almost 2,500 patients as inpatients, and almost 1,500 patients on our home quarantine platform. It's been a great success, and it's always been a passion for me as a surgeon, as an orthopedic surgeon, as an MBA in healthcare, who believes that it's a strategic model, the good operational delivery, and passion towards patient experience, as well as giving the best value add to the doctors, that the hospital functions. And in such a situation, I think it's been really an experience to manage this I think we've all gone through something very different, and all of us have different experiences. But to manage both these areas in different geographical locations, I think it would only be possible because of telemedicine and the platform that we have created both for at all junctures, whether it is within RFH or at Seven Hills or at home quarantine. In addition to the fact that we have been doing a lot of health checkups as well for people, because I think it's the well-being of the people which is taken a very back seat, which we realized after the second quarter last year. So a lot of teleconsultations, a lot of healthcare at home has taken place, and I think certain of those things definitely are here to stay if provided we give a platform to both the patient and the doctors that they are comfortable to use. So I look forward to a great discussion ahead and learning from all of you this morning. Thank you. Over to you, Amit.
Thank you, Dr. Tarang. And, I must share at this point, I do remember that, in this group at least, you and Dr. Sujit have been at the front lines of amongst the few other leaders in Mumbai and Maharashtra in managing this pandemic. And I do remember that Seven Hills was one of the first facilities that came up, if I'm not mistaken, exactly a year ago. So congratulations on that. And thank you for taking time out to be here. I was realizing that, it's a year gone by, and many times it's easier to look backwards and do a post-mortem than predict forward. And there were so many predictions that were floating around, right, on technology, on what would happen and everything else. Let me start with, a more general question. And the way I thought was we could just have a conversation amongst us, given, the nature of this topic, and move the conversation forward. And the general question is, if I go back exactly a year, and as leaders who were looking at what to do with respect to getting the patient-clinician interaction going, with clinicians not wanting to come to hospitals, with patients not wanting to be there, how did you look at telehealth, and how has that journey been from 2020 to 2021? And it's open for this group, to start this conversation, please.
So if I can just shoot, the whole issue was not the consultants or the doctors not coming to the hospital. They were the professionals were all here, and they were absolutely frontline fighters. But the issue was that the patients were very frightened of coming to a hospital, and they were under the impression that if you go to a hospital, the environment is such that you will pick up COVID. So therefore reluctant to come to the hospital. And that's where, sort of teleconsultations helped. It was like a bridge. And the teleconsultations were on a variety of things. Like, for example, if there was a patient who wanted to know that, look, I've got fever, but I've not been out. Now, what could it be? So we would start with the fact that, look, it's imperative that you get a treatment, an investigation done which is linked to COVID. And why so? Because of the fact that you're not very familiar with masking, you're not very familiar with hand sanitization, social distancing at this particular point in time. So somewhere you let your guard down. And if you let your guard down, then this is the only way that we could really find, what's wrong with you. And so that conversation starts exactly how we are conversing. You see, there's a panel of doctors who sit, and they advise the patient. So the patient feels very, very confident, that, okay, I'll come to the hospital, I'll get the testing done. And then after that, in a point in time, the government also said that you can even test them at their houses, but that was much later. But this is the initial, icebreaker, if I may say so. It was enormously helpful. And then, of course, my colleagues will add to it, but there is a long story, and there has been a great maturity which has come in as far as the teleconsultation is concerned. So if you're talking in terms of a hybrid model, yes, consultants today might advise a patient to come to the hospital after they've had this sort of meeting, clinical evaluation is much better done if you touch a patient and you examine the patient. But nevertheless, this was the genesis. I mean, this is the start point. So I just thought that I would just move into the genesis, and then the rest of my colleagues could, add on or, differ from what I've said. Thank you.
So I'll take it forward from what Sujit mentioned. So pre-pandemic, we did have a telemedicine platform for online consults, but I would say the utilization was less than 1% of our total outpatient workload, because whether it is patients or whether it is doctors, I think both the sections were very wary of just doing a consult online, and they had the typical apprehensions. But COVID definitely changed behaviors on both sides. So whether it is patients who are very reluctant to come to hospital because of the fear of catching COVID, or doctors who are at the hospital but not really able to see patients, I think both sides the mindset shifted, and from maybe less than 1% in the initial few months, actually 25 to 30% of our consults moved to our online consultation model. And in fact, the load was so much that the whole day sometimes we used to go with just these online consults. And what definitely helped was both aspects, which is the COVID consults as well as the non-COVID consults. So there was a segment of the population which had to decide whether they wanted to come to travel all the way for a surgery from outstation in view of the travel restrictions. So those were the ones who were very comfortable doing an online consult. There was another segment which was primarily looking at follow-ups post-surgery or follow-up for chronic medical conditions like endocrine and some of those specialties. So they were again the ones which immediately moved very comfortably onto online consult. So what definitely helped is that this pandemic created an environment where both sides were forced, I would say, to change their mindset and to change their behaviors. And once they got accustomed to doing this online, I mean, both sides became very, very comfortable. And that is something, which is, I think, going to stay sustained for some time. So we moved away from physical consult to the phygital, which is the physical plus digital hybrid model. And even as the pandemic began to settle down a couple of months ago, we still had about 10 to 15% of our consults continuing to happen online. And I think that is where the number will continue to stay.
Yeah, so just to add to that point, I think as soon as when, I think at the same time last year is when we sort of had our lockdown being announced, and then everything actually went into a big challenge at like one fine day, right? So what happened after that is, from a customer point of view, there's a lot of anxiety. When you look from a patient point of view, there's a lot of anxiety because like Dr. Santosh rightly pointed, some of them are worried about COVID, but a lot of them are also worried about other health issues that they had and they could not reach out to a doctor. And if you remember, the whole of the first quarter or maybe towards the second quarter also, a lot of surgeries had to be pushed down. So a lot of them could not even come back to their planned surgeries or even go, and unless it is very, very critical, they could not go to the hospital. So there's a lot of anxiety from a, let's say, patient or a customer point of view, and but clearly reflected in the kind of demand for meeting the doctors. And kudos to all our doctors, because they were actually in the hospitals, but of course patients were unable to sort of travel. So one, the technology platforms really helped, and I saw three key changes now that we are like 1 year into the system. The key changes that I saw was primarily on three areas. One, customer behavior. So even before this, even though there were telehealth solutions available, adoption to them was primarily by smaller town people because of distance or geography as a problem. But as soon as COVID happened, a lot of digital healthcare actually enabled not just the small town people accessing the big city doctors, but also, let's say, even if you're in Bombay, even if you're like 10 kilometers from Hiranandani, but you still have to do a video call now in the process. So that's when the customer behavior actually really changed and improved. Two is, we had to frantically help a lot of doctors, a lot of hospitals, a lot of healthcare institutions to bring up the technology solutions. Though a lot of doctors are convenient and know how to use the technology, but they still needed a software, they needed a computer, they needed the right set of cameras. So it might be operationally simple, but think in lockdown, you're trying to arrange computers across the country and the right systems and internet and all of them. So the key second point is doctors also like quickly adopted, and a lot of hospitals rolled out. Maybe Reliance and Hirandani would have already had all these solutions, but a lot of other hospitals actually really deployed them very fast. So the key change was doctors and hospitals sort of rose up to the occasion, adopted a lot of technologies and implemented them pretty fast, and also trained their doctors as well as lesser nurses to support in the transitions during that time. And the third key change that also happened was government came up with regulations as well as clarifications very, very fast. So I have been actually interacting, I think all of us would have been interacting with various forms of digital healthcare, telemedicine guidelines, regulations for the last, so I started the company 5 years ago and I've been working on that since 5 years. But the day lockdown was announced, I think in less than 3 weeks, we had the complete regulations up and running. So in a way, government has also been very, very supportive in bringing up, and they were very, very forthcoming in talking to a lot of doctors, a lot of people in the industry to understand what kind of regulations will support and enable this to happen. And in a way, we can look at it like a demonetization moment. The penetration of digital moved up significantly during that time, and the curve came down. But over the last 2 years since our demonetization, digital penetration has, for let's say fintech or financial payments, has grown significantly, which is what I believe will also happen. So we had a peak in online consultation. It came down a little. So now it's settling at 1%, one certain percentage, which means the baseline has shifted significantly. And going forward, you'll start seeing a gradual uptick in the number of consultations that's moving online. And that will be a right healthy mix of both, let's say, online and offline. And this is what I think we'll see in the coming years ahead of us. Yes.
I'll quickly add a couple of things. We had our digital platform, which was underutilized. We were primarily using it for our CSR activity, talking to from UP, etc. Two things quickly happened because of compulsion. One, a lot of our endocrinologists, nephrologists, doctors with chronic disorders who the patients were meeting on weekly basis or fortnightly basis quickly adopted this because that was easy. It was just adjusting medication or fine-tuning of what was already done. Two, we used it quite effectively for giving psychological support to patients who were admitted in COVID wards. So meeting doctors was impossible, meeting relatives was impossible. The relatives were sending the patients at the doorstep of the hospital and leaving them there. So a big psychological impact was happening initially for 6 months when the COVID admission started. So we used effectively our psychiatrists and psychologists as well as physiotherapists for chest physiotherapy, using digital platform to help these patients who were admitted from anything between 10 days to 30-35 days initially. So these two things we use quite effectively for chronic patients and patients admitted in the hospital.
So I think most of the points are the same things which have been covered. So just to add to it, I think apart from managing all our 100 beds at 7 Hills, which was completely done, all the specialist care was done through the remote platforms, through the help of so we had not only done the teleconsults, we also brought telemedicine part of it. So we integrated a lot of devices along with the consults. We also worked towards providing a full continuum of care to the patient. So for once we just thought, and I just felt that, okay, when I need a doctor or I come to the hospital, do I only come to consult the doctor, or there are other areas also? So there are other areas involved, whereas you may want to get blood tests done, the doctors would want to see what vitals you have. So before the consults, we created a environment of complete continuum of care. So there were certain things like, for example, if the patient had a consult and had to have a blood test done before for the doctor to see and then give the view, then those all were also integrated into that whole piece. Then obviously we use a lot of devices so that the doctors are aware. So for example, if it's an endocrinology patient and the doctor wants to know the hormone levels, so we were providing kits to ensure that the patient herself or himself checks the blood sugar levels before speaking to the doctors for at least a week, and then have an effective way or do have a follow-up in an effective manner. So I think telemedicine is a lot beyond teleconsults. It's much, much vast than teleconsults than that we all of course teleconsult is the easiest part and the lowest hanging fruit of the telemedicine, the tree of telemedicine as I call it. So apart from using it for mental health, as we also heard, we used it for the mental well-being of our staff also. We used it for the mental well-being of our staff who was with the COVID patients, who was with the normal patients, because we had created for a normal running a non-COVID hospital, we have to create these bubbles where the staff is also staying in green zones for many period of time, and they shift over. So they are also staying for whether a period of a month or a month and a half away from their families. So there was a lot of interaction which was required to be done for them. And lastly, I think telemedicine played a boon to us to take care of our free and outreach patients. As we know, in Reliance Foundation Hospital, we have a very large outreach program that we do for people in the community, which is the slums and other areas of Mumbai. So we have stationary medical units, we have mobile medical units. So all we needed was to have our paramedical workers go with the whole digital platform to them and do whatever was required for them in the field, whether there were blood tests, whether they wanted consults to provide them, and then accordingly we used to provide them for medication, because I think the free work suffered a lot, because all the patients who usually come for free services were suffering a lot. So we started this also as early as around May and June, and I think that also played a very important part towards the goodwill, and you really feel that you have done for the people who need the most and who have the least access to these. So I think that's way. So I think there were a lot of things we did: IP monitoring, we did home quarantine through the tele platform. We integrated the tele platform of consult and the medicine in our EMR, which was very important for us to do that. And we also did it for our staff, the trainings, and as well as their mental well-being. And last but not the least, as I said, to take care for the well-being of the patients who are earlier coming to our free OPDs or who are a part of our outreach clinics.
No, thank you, Dr. Tarang. And I think, the conversation around adoption largely consistent. It's so interesting to see the different use cases that came up. The next thread of conversation I'd like to start is, and Satish, maybe you can start with, your views, is features, right? And I'll tell you honestly, when I did my first teleconsultation exactly a year ago, I don't remember which platform I got on to, but there was a lot to be desired. The conversation didn't go well. We were logging in and out. Obviously, everything was getting adjusted. And I'm sure that you have gone through your journey in upgrading, adding features, listening to customer feedback. It'll be great if you can share some of what your learnings were on the technology front. And then I'll request the other leaders to give a very fair and candid critique, which will benefit the industry on what they think technology is offering and where they see the gaps.
Absolutely. Yes, Amit. So I'll give some pointers around that one, and then I'll sort of talk about all angles to the story. So one was primarily on the technology and how technology has to be sort of robust. Let's call it that way. So now there are two parts to this, because suddenly a lot of this happened, and the only access was either a computer or a mobile phone, and then most of them had actually only, of course, customers or patients have only a mobile phone. So you have to build all of the solutions to match at the mobile phone capabilities. So an Android or an iOS, or if you have a computer at home or a laptop at home, you can sort of do that. So a lot of work had to be done just on getting the basic application running, And though we had done a lot of work at the back end earlier itself, but there was like significant demand that came in, and a lot of work had to be done on what is called a scaling for us. And broadly, we see that generally also we see that video calls is what is more comfortable. And though audio calls can still be done, but that's pretty easy. But a video call is what we always wanted to enable, so that the customer or the patient can see the doctor can see the patient, and there's at least some amount of a human connection or human touch that is coming across. So that had a few issues, and there's always a lot of scheduling conflicts that came, but I would argue that most of these are the early teething issues that came in because the scaling on technology side had to happen, and doctors as well as the paramedics also had to get used to it. I keep saying paramedics because doctors are like very busy between multiple consultations, and a lot of paramedics have to sort of support them in enabling the consultations happen in a very seamless manner. And they also do between a few of them, they're doing online, and there are one or two patients offline, and they have to like sort of match all of this. So broadly on the technology, a lot of this got sorted in the first 2 months, I think, and by the time a lot of them were comfortable on both sides, right, including very small things like getting very stable internet connection, fast internet connections, all of that is also sorted. The second one is more about the experience of the consultation. Now, what you have to also understand is before COVID, a lot of departments were already using teleconsultations very effectively. It can be psychology, psychiatry, dermatology. All of them were actually already amenable in a very simple way, and a lot of the learnings had already come into our platform. But suddenly, as after COVID, every department had to start doing it. So there are always very nuances in every department, and how a doctor looks at it, what is he looking forward to, and what are the kind of reports that he wants. Because uploading an X-ray is a tough thing, because DICOM images are very, very difficult. Then you have to figure out how to make it on a camera and then upload that, because you're still getting a good quality image, but may not be as quality as a DICOM one that you would see. So department-specific changes had to be made in order to enable efficiency on both the doctor and the patient. And the last one I wanted to talk about was, so let's think like this, right? Medicine by itself is like a 2,000-year plus practice, right? Science that has been practiced. Now think, and a lot of these cues that doctors get is actually because they see you in person, and they see you walk in, they see you walk out, how you behave. All of this actually gives a lot of cues to the doctor. But suddenly when you moved all of this online, a lot of changes had to be done. And we have to give this technology platform some amount of time, right? All of them will actually get up to speed. So what has been learned over the last, let's say, 1,000 years of science is now like crammed into 1 year of technology. So I would say that that's why a lot of these small issues were there. But all of this also will get sorted in the coming years. And that's why we strongly interact with a lot of doctors across online, offline, and get a lot of these feedbacks and say, what else will give you the right kind of cues? And can we like 100% replace offline with online? No, we can't do that, right? We have to find the right midpoint, and that is essentially the key one. And at least are we able to also identify? We did a lot of work on identifying what is called as red alerts. If there are 3, 4, 5, 6 red alerts, immediately the consultation is clarified that, hey, this cannot be done online. You need to like immediately come and meet me in the physical world. So these are all called as SOPs, standard operating procedures, that we've built in every department. That also ensures that customer or the patient safety is taken care, and the doctor is also actually able to give the right advice. So these are some of the things that we saw as features and solutions that we see. Happy to hear from doctors from the, let's say, on the first-hand experience on all of these platforms.
So I'll just add to it. I completely agree with you that when you have to build a platform for telehealth or telemedicine, first of all, what is required is the stability, both at the user end. When I say user, I mean the patient end as well as the doctor's end. Second, it has to be very, very user friendly. And now this user again is both the patient as well as the doctor. I personally feel that all of us who have had the use of this, I think one of the biggest milestone which I say achieved is that the doctors got convinced to use this as a platform and break away from the traditional method of practicing the medicine. The utilization, as we have all heard, on telemedicine was like 1% or 2% or 8%, and suddenly we all saw as administrators that the utilization went up by, I mean, I don't know, by I mean, it was almost 100% for us. There was a phase in April and May when it was completely closed, and we started telehealth and teleconsultation as early as, I think, mid of April last year. 15th April and onwards, I remember the first batch of OPD appointments were given, and initially we were only getting it from all ends. The patients also, connectivity is not there. I cannot log in. We have our Geo Health platform where we do all these consults. So we have to stabilize that platform, which was done at a very, very fast speed. Then obviously the platform had to be made user friendly, and then user is a person who has never used this way. So you had to literally assist the user, as in the doctor this side as well as the patient that side, that okay, now if you have to review the report, you have to go and click this button, so then the reports will be there. If you have to review the vitals of the patient real time right now, so this has to be done, and then a lot of integration was required. But ultimately what I personally feel is that the basic principles which the Institute of Medicine has given us to provide healthcare will always be required in telehealth as well, the way it was done for the physical health. So it has to be safe, and as you rightly pointed out, you have to have your SOPs aligned, especially if it is the doctor, if it's a paramedic who is doing a consultation, that there are these red alert signs which have to be picked up, and that there has to be a clear demarcation that no, this is not possible, please come to the hospital now. Then it has to be effective. The patient should feel convinced that okay, it is worth me not going. It is, so it's all about how you convince the mindset of the patient that okay, telehealth or teleconsult or telemedicine is the solution. It is more effective and better than you traveling all the way to the hospital, exposing yourself not only to COVID. The way it will sustain in future is when they see a value add for it without COVID also. That okay, we can sustain on it. It's not always that we need to go to the hospital. So it has to be effective. Then in addition to that, it has to be patient-centric. So patient should feel that I am the center of this whole thing. Everybody is trying to focus the whole every continuum or every point around my care. So if I need to, okay, so how do we make it is we make it multidisciplinary. So at the point of time, suppose normally when we come to the OPD, the patient is referred, okay, the internal medicine person has seen or said, okay, fine, you need a referral, you need to see a gastroenterologist. So it has to be all done with a patient centricity in mind, that it is not like, okay, if I have done my internal medicine consult, now GI consult will happen after 1 week. No. So there is a person who has to follow up the whole thing as a project and ensure that the patient feels that, oh, I am in a virtual hospital. So I'm just walking through the various rooms of a virtual hospital, and that is where I think the value lies. And also it has to be timely. So we cannot have appointments taken and then make the appointments wait for a long time, because it is very frustrating. As we can understand, at home, the person is sitting and the doctor is not coming in front of the screen. In the hospital, we are used to waiting for 10-15 minutes. We'll walk up to the washroom, we'll do something else. But there at home, you don't know, oh, because if I move out and if the doctor comes and I don't see him, then what happens? And it has to be efficient. So when I say efficient, I personally feel that we are replacing an in-person visit by a remote monitoring system. So as a result, we need to make the person feel, who is on the other hand, the patient, that it is something which saves your time, it saves your money in travel, and it keeps you safe. And at the same time, the doctor also has to feel that fine, he also has to be in a model which will incentivize him the way it is done at the OPD level, because initially we thought we'll do it all pro bono, but that will not survive. If we have to make it a model, we have to make it a fair model. And finally, it has to be equitable healthcare. That means it has to be the same quality of care has to be provided to everybody who comes on that platform, irrespective of their paying capacities. So I think, yeah.
So Dr. Kannan, before I hand it over to Dr. Sujit for his opinion, I'm going to put you on the spot, by no means, but I'm going to ask everybody this question. If you were to give a score, if you were to give a score on 1 to 10, 1 being lowest and 10 being highest, on what your overall satisfaction with the user experience was last April and what that score is today, those two numbers, what would those two numbers be?
Okay, so last April when we started, I think, and I monitor patient feedback very fanatically for every service myself, because that's the only way an administrator knows what's going on the ground. So I think last year in April when we started, the feedback on a score of 0 to 10 was roughly between around 6 to 7 when we started. And now when when everybody has mastered the whole art, I think somewhere between 9 and 10 is something what people rate when they come. Because we have evolved over a period of time on connectivities, on devices, on the way we organize the whole continuum of care, and also at our place, even for after post-op, the patient of an orthopedic knee replacement, when he goes back home in a day's time, the entire physiotherapy is done online. So we have to really monitor, and people say it's much better than me staying in the hospital these days, and it's much better for us also. We have to cut the average length of stay in any case if the patient is stable. So,
Awesome.
so it was.
Yeah. Thank you, Dr. Tarang, for that. Over to you, Dr. Steve.
Yeah, well, initially when we started, we had a lot of bandwidth issues. The problem was that the visibility was not very good. I mean, it's like you and I today. We are so clear, but in the early days, there were bandwidth issues. There were also challenges with like you have somebody who comes with pain abdomen and they are pointing the right side of the stomach, and now you're stuck with whether you are going to call this patient cross because you don't know the difference between an intestinal colic, or is it an ileocecal problem, or is it acute appendicitis, or is it something else? So therefore, these were the challenges at that particular point in time. And also, very importantly, the challenge that we faced was the education. And the education was, while the doctor spoke with the patient would want to say that, should I come across? So we said, no, you don't need to, because we are talking to you and we will be able to sort this problem out. He said, अगर हो सके तो मैं आ ही जाता हूँ. He said, no, wait, we'll get this thing. So therefore, the patient education and winning their confidence was a challenge for us. The stability of the platform, as all of you have discussed, was something which was, a challenge. But now Tarang has got Geo, but we don't have Geo. We've not come to that platform. Of course, I will get to, and I'm sure Tarang
You can always get Geo.
Yeah, you will do it.
Geo international platform.
I'm sure you will do it for no cost, pro bono. Come on.
Yes.
We go back a long way. Come on, Tarang. I mean, for old friends, of course, I'm sure you'll do it.
Of course, anytime.
We'll get back to Geo. And the thing was, the challenge that we face right now is basically that the facility exists, but the fear of getting COVID in the hospital is much lower than before, and people are coming into the hospital. Now, you asked me this question. You said that you put me on a spot as what was your score from 1 to 10 yesteryear and today. Let me reverse it. When we started off, it was fantastic. I would give it 8 when we started off, because people were desperate to speak to doctors, and it went off very well. But today, I would say I'm at 5, and the reason why I'm at 5 is that the concept of medicine, while it's great to have connectivity, it's great to have distant medicine being addressed, there is always that yearning from the patient that I would like to be felt, touched. So the patient might earn coming to the hospital from the disease point of view, but they yearn to be examined by the doctor. So if you were, if I was at 8 yesterday, I'm at 5 at this particular point in time. So I thought that's something that I would like to share with you. I don't think the rest of the panelists may agree with me, but that's what I am seeing today. Thank you.
Yeah, just like to add to what Sujit, Tarang, and Siddharth also mentioned. See, at the end of the day, I think everyone now is expecting to replace or simulate the physical consultation with the digital one. I think that is what all of us are trying to work towards. So when we started, obviously, it started with basic hygiene issues such as scheduling and who will call the doctor. Will the doctor call the patient, or the patient will call the doctor? And what happens, like somebody said that the patient is waiting and doctor still not arrived. So we have our own app, which initial days, of course, now when you look at it in hindsight, it was a very rudimentary app because a lot of the things we were doing outside the app in terms of taking photographs of the prescription or getting reports emailed and things like that. So over the last 1 year, we've integrated a lot of these things into the app so that there is also a chat mechanism wherein if the doctor is getting delayed, he can push a message to the patient that, I'm getting delayed and I'll give you a call, say after 15 minutes, 20 minutes. So that kind of at least allays the apprehensions that the patient has. Similarly, in terms of ability to type in their prescriptions, put their favorites. So the whole experience, we try to improve both for the doctor as well as for the patient. Yeah, in terms of satisfaction, obviously, it's like a moving goalpost. So patients who initially were okay with just seeing the face of the doctor today want multiple things to happen online. So that's a process of evolution that all of us will have to go through. And of course, going forward, if you have IoT-based devices, you have AI and you have wearables. So, the scope or potential of this is limitless. But at the same time, we need to know where to draw the boundary. We need to know when to call in the patient. And that's something that we have to take cognizance of. What it has opened up, of course, is a new segment of the population altogether. So we have lots of patients from outstation who used to, not really come to visit us, but now they have access to all our doctors. We have lots of patients from outside the country who are getting this video consults and teleconsults done on a regular basis. So it's opened up a new target segment altogether. So it's definitely helped in expanding our reach. But yeah, it's still some way to go before we can absolutely replicate the physical consult with an online one. Thank you.
I would just add two things to this. Touch and feel that Dr. Sujit talked about is very, very important. But it is important to certain specialties. The other specialties do not require touch and feel. Radiology, psychology, psychiatry, etc. What is also needed today is combining all the information about the patient. That's where we lack. I have worked in UK for a year and a half, and the information about the patient, given patient, that is available, whether they have visited 1 hospital, 10 hospitals or 20 hospitals, is available at a touch of a button. That increases the efficiency quite dramatically, number one. 2, it reduces a lot of wastage. So if government along with startups like yours can work together, that would reduce a lot of wastage. One, also it will make doctors' life very easy. If you have all the information about the patient in given go, a lot of time will be saved, efficiency and accuracy of treatment will increase. So that is the way forward. And of course, with AI coming in, importance of giving appointments using AI, somebody who requires it on a emergency basis versus semi-emergency basis versus chronic basis, can be adopted by AI and the human interface goes away from it. That's very, very important. Otherwise, it works on your introduction basis, how you can get away or pass by things. So that should be taken care of. So a lot of wastage will be saved, a lot of repeats will be saved. And something like a Aadhaar card, if you have health Aadhaar card, which is what government is working on, that would really save billions of dollars for us.
Yeah, and maybe to last point on that was actually just on what you've done finally is there's some phygital that has come in, some amount of physical is there, some amount of digital is there, and my numbers would be 6 to let's say 8.5. it's true, the goalpost keeps changing. So what was 9 yesterday becomes 7 now, and then it keeps varying. But the point to note here is the ideal scenario is if the doctor is able to touch every patient. But because of the size and scale of our country, as well as accessibility to good healthcare, we need to identify a right mixture, and that's right, maybe the digital mixture. And a lot of this will evolve very, very fast in the next 3 years' time. And that exactly will then solve a lot of anxiety that both customers or patients as well as doctors have. Yeah.
No, I was asking Dr. Partner for a score.
So my score for somebody who's staying quite away would be from 5 to 10. But somebody who's very easily available, does not require it, would be from say 5 to 6 or 6 to 7. So it will vary from patient to patient and doctor to doctor. So somebody like a big oncologist treating patients in Africa or Bangladesh, what is the need? It would be 10 on 10. For somebody who does not require or does not, for a patient also who is sitting in Bombay, the may not be too much. They have access to everything very quickly without digital. Whereas patients remotely located who do not have access to super specialists, it would be 10 on 10. So there's no single answer to your question, I would say. But if I really have to give answer, it will be 6 to 8. Moving from 6 in April 2020 to 8 or 9 on March 21.
No, thank you, Dr. Partner. I know we are about 10 minutes remaining. I wanted to touch on two aspects from the group. One aspect, very interestingly, has led to this question that it is not an all or none situation. I think we are all clear 50 minutes into this webinar that this technology has indeed helped. It has helped create access, right? Satish, the numbers you're talking about, where 35,000 prescriptions and visits and consultations are being generated every day, just with your platform, gives us an indication that there is, a large number of people accessing this care, and the benefit of people who are not in cities are also doing that. What I want to touch upon, if the group can share, especially for people who are not on this audience, is your crystal ball gazing on the type of therapy areas and procedures and the type of remote related telemedicine. And now I'm broadening it beyond telehealth for 20 to 2025. And reason why I ask is, we obviously saw the government put out certain guidelines. There's a lot of deliberation still going on those guidelines, right? And the remit of telemedicine is not just the teleconsultation, to Dr. Tarang's point. It could be devices, it could be medicine fulfillment, it could be even interactions between experts in different cities. So if we can probably discuss, what do we feel in the next 4-5 years, the kind of therapy areas and the kind of population that will really benefit from this technology?
Let me put this one. You said crystal ball gazing, and I think that's quite unfair, because in Ahmedabad, a couple of years ago, they did angioplasty on a patient in one hospital and the doctor sitting in another hospital. So therefore, such technology is available, and it will propagate. So therefore, you're going to get new technology coming in by which you will get patients who are treated off-site. So therefore, if you are in a hospital which is robotic compliant, and I have the software and you have the software, then in that case, my cardiologist, who's sitting 50 kilometers, 100 kilometers, 150, 200 kilometers away, maybe a continent away, will still be able to treat you. So I think if you are calling, if the question really is in, the crystal ball, then in that case, I would say that this sort of option is absolutely open, and it's been proven in India and Ahmedabad, and it's already been done. So therefore, I feel that technology is headed with artificial intelligence in a direction where you could have transcontinental treatment. So therefore, if we have doctors who can do extraordinary good work through robotics, I'm sure guys in the US, depending upon the insurance, guys in the US would opt for an Indian surgeon, because we've got vast experience as far as surgical technology is concerned. So therefore, they would definitely opt for a surgeon from India. Look at transplants. Look at stereotactic surgeries. So therefore, all this can be done, and it will be done. So my crystal ball gaze is, if you want me to be a Nostradamus, well, then I am saying that this is where we are headed. So in the next 50 years, the world is going to shrink to such an extent that you will have people ringing up from Mayo Clinic to the Reliance Foundation Hospital, or to the Hirnandani Hospital, or to Nanavati Hospital, or to Kokilaben Hospital. He says, can you do this surgery for my patient? He said, of course we can. You guys can't, we can. So therefore, I think that's where we are headed, and that's where technology is headed. And please, let me tell you, I am not shooting in the air. This is reality, and it's going to happen. Thank you.
So just to take on from Sujit, I think technology is going to be the big leveler in a resource-deprived country like India. So, where we have shortage of high-end doctors. So, to give you an example, we are already doing some bit of this kind of work. So, we have 3 radiation oncology centers in the interior of Maharashtra, in Akola, Sholapur and Gondia. We set these up as part of our CSR initiative, and these were cities that even I had to look up on the map of Maharashtra, despite having lived in Mumbai all these years. And when we set these up, one of the challenges was, how do you get good radiation oncologists to go and work over there, especially when there is such a huge shortage of radiation oncologists. So what we've been able to do is, through telemedicine, all the treatment plans are actually being planned here in Kokilaben Ambani Hospital, but are being delivered there in Akola, Sholapur and Gondia. And so the level of expertise that exists in our hospital here can be transferred to those locations. And I think that is where technology is going to play a very, very key role, as Sujit said, that we will be able to actually spread these expertise across to cities, to towns which may not have access to this, and technology will be the big enabler in this whole process. That's my view.
Yeah, so some of the points that I had was, we'll also sort of look at it from the point of view of primary care, secondary care, and tertiary care. So, like we all know that hospitals are generally very, very good at doing, let's say, some part of secondary care and tertiary care, and that is when it becomes like really mandatory and really necessity for you to sort of land up in a hospital. So a lot of primary care, which also takes up the bulk of the consultations and the bulk of the healthcare load of the country, can actually happen sort of online. And as a transition from online to offline, whenever the doctor tells you clearly that, hey, this requires a physical examination, why don't you come and meet me? They would sort of go down, and then post-operative or post the second consultation, they'll again go back to sort of online. Now, if you want to sort of do crystal ball, we would say that next might be, let's say, 10 years from today, potentially like 70% of your consultations can happen online and 30% can happen offline. And think like banking sector, right? We all used to go to bank every day and come back, but today the number of times that we go to bank is like hardly any. Of course, it took a long time. It took like 20 years for the transition to happen. So potentially there'll be like a 70-30 sort of split that will happen. The reason is because healthcare is very human touch, right? You really need to feel it. They want to feel good about it. And a lot of this is, you just feel good about it, right? The doctor touches you, and then, so that's why it's going to be like 70 sort of 30. And a lot of this will also enable in different departments. Today might be it's amenable to a lot of other departments, and a lot of tools and technologies, like rightly pointed out by all our doctors, will also come up, where a lot of these machines and solutions can be a part of my mobile phone, and potentially I will have a few metrics that can be attached to them, and that could collect a lot of information and send it across. And all of this will happen for both big city, small city, and it also takes away the challenge that we face today, because like Dr. Santosh told, when I talked to a lot of very senior cardiologists and doctors, the difficulty was they could not just travel outside the top 10, 15, 20 cities. And it's very difficult to build infrastructure like schools for your kids and other amenities outside the top 20 cities suddenly in one day, right? So then a large cardiologist or super senior oncologist cannot just travel to a small town. But that problem will also get solved with these digital technologies. But I think very, very exciting times ahead of us in the medical science and patient care in the coming years and decades.
Okay, so I think on crystal ball, let's look at few stages and what will happen probably in 2040. So I think in the next 5 years or maybe much before that, all primary care can easily go on a telemedicine platform. As far as the outpatient OPDs are there, especially the first visit, even to specialists, can be easily done in most of the cases, most of the specialities on the teleconsult or telemedicine platform. Physiotherapy, rehab, I think 80 to 90% can easily migrate to the teleconsult platform, probably supported by 1 or 2 home visits. And unless a person, yeah, of course, if you need sports training and all, then you definitely need the high-end equipments. But for general rehab and all, I think that can be easily moved there. Robotics, yes, but I personally feel that for surgeries, still we are at least 5 years. We'll take 5 years because to even do robotic surgeries between 2 different entities, of course, in addition to the softwares at both ends, you will need the 5G to connect the two together. Otherwise, the surgeon sitting at the console in one hospital will not be able to do it at the other hospital. He can observe and guide people, but he'll not be doing it. So we need to understand what we want. We want people to guide us. That can be done today. And that can be done across the globe. But if we want somebody sitting in a place like RFH or KDA or Hiranandani Hospital or Nanavati or any of the hospital and doing a surgery in a remote area, just because both the sides are connected, then you need that connectivity. So that is very important for the success of surgical procedures. And we all know not everything can be done robotically. So that will still take time, and I think that will still require the setups of the hospitals. As far as diagnostics are concerned, again, I think this is something which can be easily moved out of the hospital. And as we've all experienced, I think the ICU care was the first hurdle that was crossed during COVID when we established facilities where we did manage the tele-ICUs. So I think ICU care to some extent, if we create platforms or command centers, can definitely and provide solutions both ends, can definitely be moved in the next 5 years at on a platform. Why I'm saying 5 years? Because when we do COVID, we look at COVID, but when we see ICU, our setup ICUs, it is multidisciplinary. To get the alignment of multidisciplinary sectors, that will take some time. So I think 50 to 60% of healthcare will move towards a tele platform coming 5 years, and it will be a different entity altogether. It will be a different. So like today, when we say, "Oh, I am a 250 bedded hospital, I'm a 350, I'm a 600 bedded hospital," I think going forwards, the future of healthcare is not the bedded hospital; it is the served hospital. So you can be a 100-bedded hospital but support 1 lakh people all across the country, and that will be the way the healthcare will move. And one last point from me, I think the focus 5 or 10 years from now will not be on healthcare, it will be on health. So telemedicine will very much play a very important role in ensuring that people are in the good shape of health. So that's what my crystal ball shows.
So well put, Dr. Tarang. Thank you. Dr. Patkar, over to you, and then we'll probably close this.
Yeah. I'll take less than a minute because we have crossed the time. So I'll take on from what Dr. Tarang said. Point of care will completely change. A point of care will not be beds in the hospital. It will be the technology and availability of technology at the home of patient. Especially for old age patients, they don't have to come to the hospital. Terminal patients, if they don't want ventilators, they can be treated at hospital. Oncology, radiology, I think everything except surgical departments can move to point of care. And rather than bedded hospitals, we'll have community being taken care of by a big hospital. Second thing that will probably happen is how we have adapted very quickly as a country, India, and the complete knowledge process outsourcing is happening to India, whether it is Europe or America. I think complete basic healthcare can move to India if we are prepared digitally. We have large resource of doctors, we have large resource of nurses. If they can use technology adequately and properly, we can be base of the basic healthcare across the globe. We can treat Asia, we can treat Africa sitting here because we are very, very cost effective. So I'm quite sure if the technology moves in the right directions and we as a country are prepared, we can control the way we are controlling software. We can control the entire healthcare, at least the primary and secondary care very, very effectively. And for that, collaboration between government and startups is very, very important. So complete focus can change from being bedded hospital to community care, and we can control continents across the world. Thank you.
So on this really positive note, I'd like to thank all of you for taking your time out on a weekday for this discussion. Voice of Healthcare, thank you for organizing this. I have no doubt that this discussion will be quite relevant and rich for both the healthcare stakeholders as well as Satish, entrepreneurs like yourselves who are out in the trenches building these businesses. So thank you, everyone, and have a great day.
Thank you.
Thank you very much.
MediBuddy is your health buddy. Download the MediBuddy app now. MediBuddy is your health buddy. Don't forget to subscribe to our YouTube channel for more updates.